All right, my name is Tanya Albert, and I'll be doing the respiratory syncytial virus, aka RSV. Okay, some basic things are, it's a virus and it affects the lungs and the respiratory tract by ways of the nose, eyes, or the mouth. And it's the leading cause of lower respiratory tract infections in infants and young children. And even though people think that this virus is associated with young children or babies, people often tend to forget that adults can get it too, and it's more in immunocompromised adults or adults over age of 65. And it's a lot like a cold, and it has cold-like symptoms, but in high-risk people like, you know, your premature babies or your older adults who have all these other underlying causes, it can develop into bronchitis and pneumonia. And it is a virus, and it is very contagious. So there are some key things that we need to keep in mind. And RSV season is between October and April. All right, some signs and symptoms are your cold-like symptoms, which are your congestion, your runny nose, cough, your low-grade fevers, and your sore throat. And irritability, and keep in mind in young children, they get very irritable, and I don't know if you've ever had children who had the RSV, but yes, they do get very cranky, and they don't want to eat. They get, and then in high-risk people who have RSV, you'll see wheezing on expiration and chest retractions because they're having trouble breathing. And some symptoms to keep in mind to go and see a doctor is trouble breathing, the yellow-green sputum, which is a sign of infection, and the refusal to eat, because even though they don't want to eat, they do have to eat or they'll be in trouble. And some signs of dehydration, which are cyanosis of the lips and nail beds as well. Okay, some risk factors are your premature babies or your smaller babies under 6 months old, and being in crowds or crowded areas with people who do have the RSV, which is another thing for your children who go to child care or a school, because when they get around other children who are sick, they are going to get sick too. And anybody who has cold-like symptoms, if you get around somebody with cold-like symptoms, you're bound to get it too, because it is droplet. So whenever they cough, sneeze, or anything like that, it'll transfer that way. And then another thing is your autoimmune disorders, and when your immunity is low, and that's a little cartoon there. But another thing that puts a person at high risk for developing RSV is your asthma, COPD, and heart failure patients. And yes, if they do have those, it can lead to, again, pneumonia and bronchitis. All right, some preventative measures to take. Okay, hand hygiene is very key to anything. Hand hygiene, especially with when you're handling babies, because it is associated with young children before and after handling babies, or after caring for anybody who has RSVP. And crowds as well. Like I said, you need to stay away from crowds so you won't infect anybody or get infected yourself. And I put this because if you have cold-like symptoms, don't be going kissing any babies. And then another thing is disinfect. Another thing I forgot to mention is that this virus can live on countertops and hard surfaces as like toys for hours and hours and hours. So disinfect toys, anything, hard surfaces. And this thing says, what do you mean you let your friends come over during RSV flu season? And he's just spraying the thing. And another thing is for high-risk patients, they do get a monthly injection. It's not to cure it. It's just to prevent it and slow the development of the virus. And that injection is called palivizumab. All right, some diagnostic tests to take is your nasal swab test for children, and that is to swab your sputums and your mucus to see for the RSV antigen. And another thing, as well as even though kids go to their pediatricians as well as nurses, we might not see them in the hospital setting because with RSVP, there's no cure but to treat the symptoms, really. And so another thing that we can do as well is the physical assessment. You pay attention to the lung sounds and how they sound. You go and ask for their history, whether they've been around anything that can trigger it, how long, what kinds of symptoms, because during my research, it did say that doctors most likely will just ask you those questions and do the swab and just say it's RSVP because of the season, the time, and the type of symptoms that you have. And so for severe cases, when they do get hospitalized, they do the chest X-ray, the blood and urine cultures to check for infection and hydration and your O2 because you can't breathe. All right, so what are some treatments? Okay, primarily they're supportive because you do go home, so anybody who's taking care of children with RSVP, you're going to use the bulb syringe to suction that mucus out so they can breathe easily. They will hydrate in frequent small amounts because of the dehydration. You don't want to overdo it. And then sitting them up because they can't breathe and all that mucus. Acetaminophen for the fever, Tylenol, and the cool mist vaporizer to moisten the nasal passages. And for more severe cases, your IV fluids, oxygen, and bronchodilators, and that will probably be in the hospital setting. But so as for assessment-wise, diagnosis, and as far as diagnosis is, even though you probably won't see these patients in the hospital setting until it's progressed, but some diagnoses to keep in mind would probably be fatigue, ineffective feeding patterns, ineffective breathing patterns, and urinary retention. And you just want to try to treat the symptoms. And another thing is that these symptoms can last for 2 weeks. So just trying to alleviate them so the infant and the person who has it can get the air that they need and keep them hydrated. Next slide. And so the LPN role is primarily supportive. You want to educate the parents. You know, I know parents have a busy schedule, so if your child does have RSVP, don't send them to school. Don't send them to daycare because, like I said, it's very contagious. And for the LPN role, if hospitalized, oxygen therapy, IV fluids, droplet precautions because it is spread by the eyes and the mouth, and the CBC to check for infection.